Live from the Business RadioX studio in Atlanta, it's time for Dental Business Radio, brought to you by Practice Quotient. Practice Quotient bridges the gap between the provider and payer communities. Now here's your host, Patrick O'Rourke.
Hi there, friends at the dental business community. This is Patrick O'Rourke, your host on Dental Business Radio. Thank you very much for joining us. I'd also like to thank our sponsor, Practice Quotient, PPO analysis and negotiation, top tier professionals that represent top tier providers to make sure that they get top tier compensation. If you're a top tier provider and you don't feel like you're getting top tier compensation from your business partners, i.e. the insurance companies, then you may want to give the professionals over at Practice Quotient a call at 470-592-1680. That's 470-592-1680 or www.practicequotient.com. That's QUOTIEN as in Nancy T.com. If you're not sure, ask your high school kids. They'll tell you. So here we are. Today I am super excited as I have one of the brightest minds in the industry with us, and Karin Wittich from Amos, the incoming executive director, and she is replacing the Honorable Scott Farrell, who is going to be putting his toes in the sand, I'm sure. Scott, thank you very much for all of your diligent hard work. You know, you have a lot of love coming from me, my friend. So Karin, how are you?
I'm great, Patrick. Thanks for having me.
Oh, it's my pleasure. I appreciate you coming on. When you're the executive director, do you get hailed as the chief? Is that supposed to be played when you walk in?
I hope not. No, not at all. I like to blend into the background.
Like Wallflower.
Yeah, that's me.
Yeah. That's not what I would use as my first description, really, when I think of Karin. And so Karin is not new to Amos or to the industry. Karin has been helping with practice management, government affairs, lobbying, and kind of acting, and this is in my words, as a conduit in a bridge on her own, a bridge to the payer community, between the provider and the payer communities for the OMS community. Would that be an accurate description?
Absolutely. I've enjoyed serving in that role. I just celebrated my 22nd year at Amos, and I've been working with the payers in my role as an administrator in an oral surgery practice before I joined Amos 22 years ago. But this morning I attended the opening session of the AADC, which is American Association of Dental Consultants, and have built what I believe is a great relationship with many of the payers over the years. And if it wouldn't have been for the pandemic, we would have been meeting this week in Florida with the payers, which is always a great time to talk about areas of mutual interest and concern. And they've been very receptive to our reaching out and the things that we've done together.
That's terrific. There's an interesting thing where when I'm talking to insurance companies, they tell me, they're like, "Oh, you're consultants," and I'm like, no, I'm not a consultant. Because in the provider world, that means practice management consultant, but and to me, in the payer world, that means the dental consultants, which are the actual providers that come in and are looking at claims and helping set the protocol for claims adjudication, and that's what that organization does, right? So this is bunch of dental consultants that are actually either current or former physicians that are reviewing trends.
Yep.
Right.
Yep.
And so it is, a barnstorming good time. I've heard. Would that be accurate? All these consultants.
I've gotten to call many of them my very good friends. And others, when we agree to disagree, we, are respectful to one another, but they do a very good job of, bringing in speakers to talk about the latest industry trends, as well as, there's some social aspects to the meeting as well. But, we don't want our members practicing fraudulently, and we don't want the dental payers to unfairly reimburse our members. So we try to find common ground. I certainly try to support them whenever able, when our members might be billing incorrectly. I learn a lot from them. We implement that into our coding workshops then. If we're finding that there's some concerning trends amongst the dentists and the oral surgeons specifically, that we can correct their behavior. Oftentimes we might get told that there's billing trends, if you will, but when in fact it's not being done by the specialist. When you dive deeper, it's some of the general dentists that perhaps don't have as much experience coding, especially when you're looking at some of the more complex oral maxillofacial surgery procedures, if you will. And I don't believe anybody. There's a very small percentage of people that would set out to intentionally, fraudulently bill. Most of the time, they just don't know. 3 to 5%, which is pretty low. And we don't necessarily want them as members either. So we're always, extending that olive branch to make sure that, if there is something going on, give me the chance to talk to my member, let them correct their behavior, have some education. We offer great coding workshops for our members and their staff so that they can learn to code appropriately. But where we fight with not fight, but where we'll go to task with the payers is making sure that things are reimbursed for a fair and equitable price, because it's expensive to run an oral surgery office and only getting more expensive, through this pandemic.
Are you telling me, Karin, that the cost of doing business for oral surgeons has not gone down in the midst of a pandemic? Is that what you're telling me?
Yep. I'm telling you that, Patrick. You heard it here first.
You should see my shocked face.
I know. Mine too, right? You mean between supplies and PPE and having a hard time finding staff. And it's been a tough year for our industry. But I will say that we were one of those specialties that remained open through the pandemic when allowed by state or local government. And we were there to serve when people were afraid. They were afraid to come to the dentist. They were afraid to go to work. The oral surgeons showed up, and they were an essential part of the care that was provided out in the hospital setting and outside the hospital setting.
Keeping folks out of the hospital, out of the emergency room is just as crucial, and helping out, within the emergency room. And so it was all hands on deck. So,
from our residents to our attendings at hospitals to faculty members, Dr. Nanini was our president for this, and he is a residency training program in New York, and his residents were on COVID for us, managing airways and filling out, unfortunately, death certificates. They're part of the healthcare system, and they were instrumental through this crisis.
All right. So kudos to all of those oral surgeons in the Amos community. Gold stars all around. And thank you very much for keeping all of us safe, because it's a collective effort. And COVID is, hopefully we're at the end of the tunnel, knock on wood.
Our eyes are set on Nashville.
And so, Nashville, Amos is happening in person. I have check it out. I have my COVID card right here. This is my hall pass.
There you go. Great job.
And so I will be there in Nashville too. And you can't keep me out. I'm going to knock down the door like Karin Wittich. And so I'm super excited, and I really thought I'd never say this, but I can't wait to get back on the road. I do miss the conferences, and Nashville is an awesome place. So Amos is happening. You guys have the dental implant conference in December is also on. Is that going on in Chicago? Yeah, that's terrific. That's a very popular event, isn't it?
It really is. It's the premier dental implants conference education, in my opinion, in the industry. And our committees work really hard to plan that education, and we're super excited about this year's event.
Gotcha. And big shout out to everybody on the committees over there, and that help put things together, like Lauren Ope and Patty Serpico, Bridget, Alexis, all of you guys. Thank you very much. Shout out.
They do a really great job.
I do.
And our volunteers, like you said, they're the best in the business, and they give up their time so willingly. We're so appreciative of that.
Yes. And also Sue, who I hear wants to put her toes in the sand. Very
sure
soon.
Does.
Yeah, that's so Sue Mosman, always done a good job, been very kind and gracious with me and my organization. So thank you very much, Sue. We will miss you, although I hope you enjoy that cocktail when your toes are in the sand. So let's go back to the dental consultants meeting that started this morning. Is there anything that you can share? Like what trends are they talking about? Like what's at the top of like newer claims or what's the
So
top three things that are happening right now?
we just scratched the surface this morning. The first session was Admiral Ricks, and he was kicking it off related to the integration of dentistry and medicine and the oral health connection to total body, and what can be done, and what some of the pilot programs are doing, for instance, Indian Health and some others, where they're actually teaching brushing in the primary care setting, and preventing oral disease early, and how that translates then as children get older. And sometimes the dentists are the first ones to actually see any children, and specifically related to well-being visits and making sure that they have good oral health. And then also the transition from dentistry to medicine, and how that looks, if you will. Meaning, will dentists be giving vaccines to people in the future? Some states, they're already allowed to do that. Blood pressure in adults, blood sugar levels, A1Cs. What is the future going to look like in dentistry? We've been talking about this for a long time, but I think the conversation is growing. And so that's kind of where it kicked off this morning, just some of the different programs and services that are being piloted throughout the country. And then they talked a lot about caries, which isn't always on our radar. And then they'll have a claims review session, which is when they'll get into more details. So today was more of a keynote speaker and, just some high level industry trends, but nothing real specific yet. Tomorrow we'll hear from Marco at the ABA, and they'll have a claims review session. So that's always great too. They're the most recent update from the flagship ABA.
Yeah, I'd like to listen to Marco speak. He's a dynamic speaker and knows what he's talking about, and it's always has some interesting insights.
Yeah, he's got all the data. It's great.
Yeah, well, there you go. It's all about the data, but you do have to read and interpret the data, in order to reach the conclusions. Data on its own, and especially when you have a lot of data. Maybe we should have another show in Nashville, and we can talk about what we've learned over the course of the last 6 months. Maybe we'll see. So that's what's going on there. And there's some, as far as your members go, or the Amos, the OMS community. What do you think what's everybody collectively excited about right now?
Well, honestly, the return to work and the return to, travel and return to meetings and gathering and education, I think is really exciting. On the advocacy front, we just recently held our first virtual day on the Hill, and it was a great turnout. We had really good meetings with members of Congress at the federal level. Some of the things we're talking about are ALSA, which is an Ensuring Lasting Smiles Act. And it's for craniofacial coverage from the medical and dental community, the insurance carriers having to, have equity with their reimbursement for children and adults with congenital and craniofacial anomalies. It's unfortunate that, they'll definitely pay for like a cleft closure and a cleft lip and palate child. But if that child needs dentistry when they're older, it's often not paid for, which leaves either patients in a bind, parents in a bind. So we're asking for is equity, so that those patients will get the same insurance you would get if you had a knee condition or a hip condition or a club foot or something similar. So that's been a really big ask for us. Student loan debt is another thing. Higher education is very expensive. Our members go an additional 4 to 6 years after dental school. So their debt, is compounding, obviously. And we're asking for some deferment, so they don't start paying their loans back entirely till they're done with school, rather than many of them start paying back in their residency after dental school.
I didn't know that.
Yeah, and then there's a lot of talk about dentistry and Medicare, and we believe that Part B is not the answer. Part C, or the Medicare Advantage plans, seem to be reaching a good portion of our elder population. We certainly believe that medically necessary dental procedures should be performed on patients that have, medical conditions that require either extraction in time in before a kidney transplant or any kind of organ transplant, really. So just telling our story about how much we do in the office and how much, what a cost savings that is, the anesthesia we provide, and really what an ideal situation our office-based surgery centers are and the care that we provide. If we were to take all that care into the hospital setting, it would just inflate the cost systems throughout the healthcare arena. And, we do it safely, we do it fairly, and at a fair, what I would say, fair reimbursement. And I just don't think that people understand that the way we operate is like many hospitals, and our practice expense is significant. So, dental insurance maximums haven't been increased in years, but, patients have paid for dental insurance. And obviously we work with our doctors to make sure that, they're signed up with employers and understand what carriers are in their communities and states, and rely on you to help our members understand that contract process. Doctors are, often left in a bad spot, not really understanding who they've signed up with and what's going to be reimbursed. And I always say in oral surgery, it's really unique because we cross medicine and dentistry, right? So we might bill for one procedure, fractured jaw with tooth removal, we might bill medical and dental, and we might get paid only from medical or only from dental, or we might be able to coordinate those benefits. So we try to maximize so that the patient benefits from the premiums they pay or their employer pays on their behalf. So oral surgery is very unique when it comes to insurance reimbursement.
I couldn't agree with you more. It's the only discipline that really firmly straddles the line. It's the fence, if you will. It sits right there in the fence between the medical and the dental worlds, or the two business segments. Not a lot of folks realize that, they're like buckets, right? So medical is one huge, massive bucket, and then dental is a totally different business segment. It has its own, loss ratios. It has its own. It's just run as a totally different business. A lot of times it has different claim systems. It might as well be a different business. And so, and then when you're trying to coordinate, I get a lot of questions, and the answer is, guys, it varies. It varies by the employer group contract, or even the individual contract, or the Medicare contract. So unfortunately, it's not like Baskin Robbins with 32 flavors, right? It's there's quite literally 10,000s of variations, and everything gets dictated by the certificate of coverage of the insured, and that supersedes the provider contract. And so that's why it becomes difficult.
And patients don't always understand that, so we try to do our best to educate, give the resources to our members so they can educate their patients. And any patients that are listening, or anyone with interest in oral surgery and what we do, I recommend going to myoms.org. That's myoms.org. And that really tells the story of what oral and maxillofacial surgeons do. It's a great site, and it really helps explain, if you're going to have oral surgery, how our doctors are trained and what you'll experience during your surgery. So,
because oral surgeons have nurses, and it's just like a hospital setting. It's basically outpatient, and it is quite a bit different than a hospital. So there's a lot more overhead. It's more clinical. I don't think that's the right word I'm looking for, but it's more a comprehensive, typically, with all due respect to dental practice. But there's usually not an RN on staff at the dental practice, right? And that's to deal with any potential complications, because if you're going to be put to sleep, anesthesia is what can cause the most complications. That's what I'm told.
Absolutely. And we pride ourselves on, safety of anesthesia, and our model, the way we deliver it with a team, as you said, with the RN and experienced people in the room. And they do a great job at it. So.
And, I know a lot of guys and gals, that do a lot of work at, I call it, charitable work with, local clinics to take care of special needs, because that gets even more complicated. And typically they're doing that for free because they got to go to a hospital and do it. And they're doing it because they love to do that type of stuff. It's almost like orthodontic surgery. I've had many conversations with folks, and they're like, orthodontic surgery, I just love doing it. That's what I went to school for. Or it's like their art. They get a lot of pride from doing orthodontic. But unfortunately, on the medical side, there's zero. The reimbursement for it is pennies on the dollar. Like they're losing money by doing orthodontic surgery. So a lot of folks skip it, but it's difficult to get the the people in the medical world to pay attention. I mean, if you think about oral surgery as a whole, right? When I'm talking to them, they're like, but you want to talk to me about oral surgery? I'm dealing with, dialysis. I've got orthopedic surgery. I've got cancer. I've got corona happening. I got, diabetes. And you want to talk about oral surgery? That's not a slice of the healthcare cost pie, bud. And this, Pat, and this is what they tell me. They're like, that's a crumb. Like they simply don't have the time or the bandwidth when they're dealing with so many other things. And I'm not saying that's fair, right? It's just kind of a fact, and then, you take that oral surgery piece, and then orthodontic is like this small.
Yeah.
I guess our listeners can't see my fingers, but they're squeezed really close together. So it's for everybody that's out there doing orthodontic surgery, for the love of it, keep on keeping on. You guys do you. So what's exciting? So this is what they're excited about. Everybody's excited about getting back out, and hey, we're open again. And the doctors pretty much have all the vaccines, so they've probably even taken a vacation.
We're vaccinated. Yeah,
I'm vaccinated too. John Ray's not. I don't know about John Ray. He's scared of vaccines. He's scared of needles. He's waiting for them to be able to put it in one of those purple cups, and then he'll drink it. That's our producer, John Ray. He can't talk back during the show. And so
that's not fair.
Yeah, no, it's not, but it's a lot of fun.
No, we're really hoping that, different parts of the country certainly are experiencing a different flavor of the vaccine, if you will. And when I was in the South recently, we were at the Southwest Society meeting. It was so great to see people gathering again. But in Chicago, we're still at a 50% occupancy. We're supposed to be opening up, and hopefully by July we'll be back opening. Right now, Amos employees are still working from home and doing a fantastic job through the pandemic. And our members as I said, have been working. Chicago and Illinois is a lot different than, say, Florida and Texas and other states. But, we're looking forward to getting back and gathering and seeing our members and being there for them and putting on a great show for them. Education, the exhibit hall, and making sure that vendors, also have a great experience. And we want to do all this safely and, following the state rules. And, we're going to do our very, very best. And during COVID, there were a lot of, fear about, how the virus spreads, et cetera. And we were trying to keep up with all the rules coming out from the CDC and OSHA, and we're still doing that, right? So PPE was scarce, and Amos came together and, made masks available to our members. And one of our partners, Southern Anesthesia, tried to source as much PPE as possible. And, we really tried to be there for our members and give them the resources and tools and interpret the CDC guidelines. And we have a whole page dedicated to COVID on our amos.org for our members. So it was a heck of a year. We were working around the clock to make those resources available to our members so that they could go and do their surgery, do it safely, and understand what the rules were. So nothing like working in a pandemic, but we did it. And I'm grateful for the technology. As much as I'm zoomed out like everyone else, it's also given us a great opportunity to continue working and keeping our people employed.
Absolutely. Couldn't agree with you more. And, it was kind of new for me and everybody else that's alive on the planet right now. And, when I talk to folks, all of our clients are business owners. I was like, well, listen, as business owners and entrepreneurs, this is new, but it's not new, rolling with the punches. So that's what we're going to do, guys. And so
I had a conversation with a manufacturer last week, and he said, out of all of dentistry, he said, the oral surgeons really kept me going because they stayed open. They opened when they could, and they saw a lot of patients. So we have that vendor's going to show up in Nashville and just be grateful for the oral surgery community. So I think a lot of legislators didn't realize how essential we were during the pandemic, how essential our members were to their communities by keeping patients with dental pain out of the hospital settings.
Right. I mean, I could tell you several stories. So we have in Eastern Tennessee, there's only so many providers in, the very east part. And, they're open and they're seeing all these folks, and, these people have toothaches and abscesses, and they are going to be in the emergency room if they weren't there. And
that's right.
And like, that's a very, very big deal. And so that's what it's all about. And, I have to say that I highly respect, and I think everybody does, the Amos organization. It's really, as far as being able to educate, advocate, and be the catalyst and go to as an association, you guys do an incredible job. Everybody there. It's a big stamp of approval when you're like, well, Amos is involved with that, so it's so kudos.
Well, we appreciate you saying that. And I'm so excited. Pleasure. It's been my greatest pleasure to have served as the associate executive director, and now, my dream job to become the executive director. And I hope I live up to my predecessors, and I'll do everything I can to make sure that happens. But we have a great team at headquarters in Rosemont. We really do. And everybody cares about our membership and how they make a difference in their lives. And it's a great organization, and I'm thrilled to be a part of it.
Yep. The question is going to be, who's going to fill Karin Wittich's shoes?
Yeah. If anyone knows anyone, please turn that name in to me. We are doing a national search to look for the position. The board has, elected to have qualifications that far supersede my credentials, if you will, but my experience. I grew into the job. I started off as the practice management manager because I came from being an administrator of an accredited oral surgery center. And then I got promoted to director of the division, and then the associate executive director, and took on the PAC and our advocacy, our federal and state government affairs, as well as our for-profit side, which is Amos Advantage. And, those are the services that our members can really benefit from using and partnering with those partners, because they really help, keep the dues what they are by subsidizing, monies to Amos. It really helps with our non-dues revenue. And it's been a journey for sure. It really has. And so I've taken all of this on, and now to go and to replace me, it'll take a unique person, but I know we're going to find the right person that'll work well with my team. And I'm looking forward to meeting that person.
That's pretty awesome. You always got to take your time. Look at John Ray polishing his resume over there. John Ray, hey, listen, they're not going to take your resume filled out in crayon, buddy. Chill out. And besides, I keep you busy over here. Well, good luck on your search. And if anybody knows any, I don't know, what was it?
Health policy.
You need to be lawyer, health policy, understand medical and dental, and be able to navigate the channels of the payer community and the provider community. That's a lot of languages. You need to be fluent in half a dozen languages there.
Yeah, it's going to be a challenge, but I'll still be there to help out too.
Right. So. And there's got to be.
And I have the greatest team. My team is just phenomenal.
Is there anybody you want to give a shout out to on the radio? They'll be famous.
Yeah, all of them. You've mentioned most of them, but we've got Janet and Jeannie and Sandy and Patty, as we already mentioned, and Bridget and Alexis and Sue. And it's, people have been there a long time in my area, and it's a well-oiled machine, I will say, which has given me the opportunity to do some other things like take on Amos Advantage and take on some of the, membership survey roles and strategic planning, which I really like doing. We're at the tail end of our strategic planning process, and, the things that we want to get accomplished over the next 3 years, we'll be flushing that out at our next board meeting. So, and finalizing that plan. So we're excited about that.
Gotcha. So let's give a sneak preview to the Nashville Amos event. Like what's the keynotes? Is there going to be some fireworks, parade?
Yeah, so there's going to be some great things happening. Our theme is ensuring our future through wellness and diversity. We're going to have a great, as we always do, a keynote speaker and opening ceremony. What those look like right now, Patrick, we're just not sure. We hear that Nashville is going to open and lift all capacity May 14th. We'll have our wonderful exhibit hall, our educational sessions. The president's event is scheduled for the Country Music Hall of Fame, which will be awesome. We're looking at trying to move some of the ballroom events, if you will, to outdoor spaces if possible. And we just, at this point, we've been planning in a pandemic. It's really hard. As of 5 weeks ago, we were looking at maybe capacity limitations of 300 people to 1,100 people throughout the whole conference. Now we're looking at, just maybe no capacity limits, but, especially with vaccination. So we could be at, a really great, successful meeting. Nashville's such an awesome city.
It's one of my
I took the
cities.
first meetings there in probably, I think it was 2000 or 2001. And every time I take coding or practice management there, we sell out. So I'm hoping our members bring their boots and come to Nashville and learn and visit our exhibitors, and it'll be a great meeting.
Right. I do too, and I will be there. So the question is, and I have this ongoing conversation with my wife because I used to go to Nashville all the time, and I, in Texas too, prior to COVID. Right. I feel like I should own a pair of cowboy boots. In my wife, and she's like, "You're not spending $1,000 on a pair of cowboy boots." I'm like,
"Oh, Patrick, it's the best pair." I bought a pair.
I should do that, right?
Well, I have 15 pairs of cowboy boots. Truth be told.
See,
that's my secret.
Karin would have said I'm slacking on the country dance.
Boots. That's right. You need to show up in boots. I used to always country dance, and so everywhere I went to Nashville or anywhere where they sold them, I bought them. So last year was my newest pair, and they're probably my favorite. So you definitely will see me in cowboy boots in Nashville.
Well, now I'm going to definitely have to buy a pair.
I think so. The pressure's on.
What about a hat? Do you wear a hat at all?
I do. I have hats, but I won't wear one. It'll be too humid or hot. That's just strictly for dancing. What about you, Patrick? What's going on with your company? How are members treating you?
Well, I think that all of your members are terrific. We have lots of oral surgeons. All the projects are going along. We've had to pivot, obviously. So there's been many, depending on the state, right? There's some of them were closed longer than others. And there's been a lot of strategic changes. And I won't say with every single one of our projects nationwide, but I will say with 95% of them, absolutely. Where, it happens and then everybody's like, okay, well, we're closed. So let's call Pat and Scott up and figure out what we're doing here. Not just from, a contract standpoint with us, but also like, what are we doing with these? And so kind of a theme, and this is more anecdotal. The practice is that for some nutty reason, we're willing to take 50 cents on the dollar before, against, our advice, but they're not. They said, you know what, I'm at risk. My family's at risk. My staff's at risk. We're just not doing that, and we're booked, like we're busy. And so there became a bit more attention put on what we do, right, as a whole. And so then everybody opened up. And so some of them kind of paused and then they opened up and they got slammed. And so then they've had to, not a complete pivot, but more of a tune up. And so it's been like doing not just one project, but 3 or 4 projects, depending on that practice. There's not a one size fits all solution. So it really depends on them, their volume, their area
who they're dealing with.
Right. Exactly. And obviously the concentration of carriers and their member populations in each state is going to be, a factor. So that it's from, an intellectual perspective, it has been fascinating. It really has. And I'm not saying I necessarily want to go through it again anytime soon.
Right.
But it has been fascinating. And I think that it's certainly given, it gave everybody a bit of time to focus on their business. And what we do is an integral part of their business. It's more important than the cotton balls, guys. It's more important than a lot of the stuff that you're spending a lot of your energy on. And I think that folks finally realize it because they had a chance to stop and think, and they're like, okay. And so now you're not just taking a call with me and my team on your lunch break and paying attention for 15 minutes while you're swallowing a Jimmy John sandwich,
Right. They had time.
Right. We were sitting down and we were having very, comprehensive
and while they were watching their overhead go up.
Right. Exactly. And so it was, the first part of it was kind of stressful. Because it is the unknown and then the overhead, right? And what are we going to do? But then it's really turned into better news. And I think that the relationships that we have with our clients have gotten much stronger because of it. We've just had more time to spend with them and really kind of demonstrate value as well, and help them with their strategic planning. So as far as silver lining goes, that's a pretty big one for us. And
that'll be a great story to tell while you're at the annual meeting. And I think that's so key for others to learn from that experience.
Well, you invite me on stage and I will be happy to tell that story. Or share this broadcast with everybody that's right. And a member of Amos, which I'm sure it will get around. Lots of Amos members listen to this right now. And by the way, listeners, if you are enjoying this particular show, be sure to like it or rate it 5 stars. If you don't like it, please let us know and share your feedback. You can send it to John Ray, jray at dentalbusinessradio.com. Is that your email, John? No, it's not. It's jray at Business RadioX, or is it North Fulton? All right, so jray at Business RadioX. If you don't like it, let John Ray know. He has a lot more empathy than I do. That's really the truth. That's not a joke. But you can always find me too. I'm on Instagram too. Thanks, Nate Coverman. And Facebook. Whoever put me on there, I'm going to choke. And you can find me at Practice Quotient or on LinkedIn, Twitter at GA Benefit Expert, or at PracQuo. I'm pretty easy to find. I'm definitely not hiding. So I do like feedback a lot. And all the listeners, if you enjoy the show, please share it with others. Like it. You know what you will get? You'll get good karma. I promise. Lots of it. Heaps of on you. Now, if folks are looking for Karin, I guess what kind of people call Karin?
Our members call, payers call.
I think they already know how to find you, don't they?
Yeah, they pretty much do. But I'm happy to hear from our members, and I can be reached at Karin, KARINW, at AAOMS.org.
Okay,
Karin
very good.
W.
And then you also mentioned myoms.org. And so myoms.org is a place where
it's a great patient site. That's our public facing site. And then amos.org is our member website, which is going to be redone this year in 2021. So we're excited about that.
And then the Amos Advantage Plan, these are like the best companies in the world, right?
That's right. They've been carefully vetted and selected to be our partners. And they, are unique to, they're not in competition with one another, if you will. We select from very strategically different sections of how they impact the oral surgery practice. And, they have their own aisle at the annual meeting. And I would encourage everyone to visit amosadvantage.org and really make sure that you visit those members, those partners, because they give great pricing to our members, and it's a great service that is provided back to Amos. And Sue Mosman, I have to say, really grew that program from an almost nothing program in 20 years to just a tremendous program and building relationships with people like you. You know, Patrick, I remember meeting you in Florida. I was speaking and you came in to hear me speak. And afterwards we talked, we followed up and met again in Atlanta. I think you were supposed to only stay an hour and we ended up talking for, I don't know how many hours. But that was a great day and I learned a lot, and the partnership has been great. And we're proud to have you as part of the Amos Advantage family.
Yeah, well, we are proud to be part of it, and I love our conversations. I feel like we kept this one very general. A lot of times we go down rabbit holes. And,
we sure do.
And totally, it's, talking
well,
about
we can do it again someday.
Medicare. Yeah, absolutely.
Yeah.
I think we will probably. So again, fair listeners, if you'd like this, if you felt like this content was good, let us know, and let Amos know too, and say, hey, we listen to that podcast. We need some more good information, because they're looking for ways to reach members. And, there's a broad spectrum of ages of Amos members, right? And so the new school has their different media channels that they prefer, and the old school has theirs. And so if this show or podcasts in general are something that you like, they would like to know that.
I would like to know that. Absolutely. Okay. I'm actually talking with John Ray about this and bringing this something to our board to discuss, because I think this is a really great way. You go out for a walk and you can, we can talk about what's going on at Amos and dive deeper and interview our members. And so I think it's a great thing. And I'm so grateful for the opportunity to have met John Ray and to talk with you today, Patrick. It's always a great time.
Oh, it's absolutely my pleasure. John Ray, you want to say something? You want to say thank you, Patrick? Is that what you want to say?
Thank you, Patrick.
John Ray, thank you, sir. I appreciate you and the entire team at Business RadioX. You guys do a terrific job. I know I like to ink your chain a lot, but that's really for the amusement of all of the folks that are listening here. I'd also like to give a special shout out to Bob the Man Clark, and Rita over in Kentucky. Thank you for all of your support. Give a shout out to John Hughes as well. BD Tyner doing a great job as the president over there on the board.
Yeah.
And
he's doing a great job.
Yes. In leadership in time of crisis. That's real leadership, isn't it?
Yeah, it really is.
And outside of that, I think that is all that we have. Is there anybody else that you want to give a special shout to?
No, I'll just say, Scott Farrell's been great during this transition process. It was an arduous application process for me. I went up against some really great candidates, and my commitment to the specialty is as strong as it ever was, and I'm honored to be able to step into the role of executive director, and thank everybody at Amos and all of the colleagues and the members that I've heard from, and the outpouring has been substantial. All the past presidents, not one did not reach out and say, job well done and welcome and accepting me in this role, and I'm so grateful. And of course, to Eric and my family, it means the world to me that I have this opportunity. It's kind of like pinching myself that this is really happening. So, well, I'm sure, Patrick, you and I will have many more conversations as I assume this position and hear from our members. And, I do want to hear from them, and I hope that they understand the value that Amos Advantage and Practice Quotient brings to their practice. Very meaningful.
Right. Well, thank you very much, Karin. And really the show is about what Amos does for its members. They do an outstanding job. So thank you very much, Karin. Congratulations.
Thank you.
And Scott Farrell, we gave you some love at the beginning, and I'll give you some more here at the end. You are the man. You will be missed. And I hope you enjoy playing golf or go-karts or skydiving or whatever it is that you are going to be doing in retirement. I'm slightly jealous, and I'm hoping that I will get there one day soon. So Karin Wittich, the woman of the hour. Thank you very much for being here. It's always a pleasure. Congratulations again. And with that, until next time.